But first, my thoughts on universities and what's happening there. United we stand, divided we snitch. In addition to the lockdowns and the mask mandate, presidential nominee Joe Biden has one big COVID plan.
Individual states like New York and California are already hiring and training thousands of tracers. But we need to do more, including hiring at least 100,000 federally funded workers to perform contact tracing and other public health tasks. And they should begin to be trained now.
And they are being trained by the thousands to track your whereabouts and who you've been in contact with using apps and person-to-person interviews. Tracers are essentially health snoops. They're recording all your interactions. Now, this is a tracer trainer in Houston.
There's been plenty of people who have broke down and cried because they thought they were going to lose their jobs. And they don't want to give any kind of information that we don't already have in our hands.
Now, liberal governors and mayors have mostly waved off privacy concerns. They've not only embraced the tracing regimen, but they've taken enforcement of their health orders a step further. Hogan in Maryland and Bashar of Kentucky set up hotlines to rat out neighbors.
Those who are not in compliance with our state orders, this is a call that can allow government to know, to make sure that we know what you know.
L.A. Mayor Garcetti was even more explicit.
You know the old expression about snitches? Well, in this case, snitches get rewards. We want to thank you for turning folks in and making sure we are all safe.
Turning folks in. That snitch mindset has now hit universities across America. To return to campus, many college students are being required to sign contracts with their schools promising to abide by new COVID requirements. Mask wearing, social distancing, eating alone in some cases, routine testing, no overnight dorm parties, nothing. Violators face suspension or expulsion. But how do they enforce the COVID contracts on campus? Enter the wellness ambassadors.
TU Public Health Ambassadors are volunteer students, faculty, and staff who will model and monitor physical distancing practices.
The university is encouraging all of our, students to abide by the COVID guidelines. And sometimes we may have to enforce some of these guidelines if people do not abide by them. We also have our wellness support ambassadors who will check for compliance at the entrances of all of our buildings and our classrooms.
The wellness support ambassador will check your papers at the library and before every class. That's right. You pay $50 to $60, some cases $80,000 a year to have your kids basically enter what is now a Soviet-style People's Republic of Education, where their peers are encouraged to spy on them and turn them over to administrators. You might call it Snitch U. If you think I'm exaggerating, I'm not. Now, bear in mind, most of these universities require all returning students to take COVID tests before they can even enter campus. Columbia is recruiting student ambassadors to help police the student body. The University of Miami is paying $10 an hour for their public health ambassadors, and they're not alone. A slew of colleges are training health minders and loosing them on the student bodies. At my alma mater, NYU, students are instructed to confront anyone not wearing a mask or social distancing and, quote, if the person persists in not complying or responds confrontationally, you should not pursue the matter face-to-face. Instead, report fellow student noncompliance. These universities are not playing around.
We need people to adopt healthful behaviors immediately. And I can tell you, we're going to pull out all the stops from the research evidence. And also, we're going to have a high level of expectation that folks in the community will respond to our guidance. The threshold will be very, very low, and we'll be holding people accountable.
The question, which we will explore shortly with experts as well as a Texas student, is this. What effect do these university COVID student spy rings have on community cohesiveness? Does it undermine the academic and personal freedom young people need for growth intellectually and socially? And are our institutions of higher education, no matter what they're calling these kids, health ambassadors, forcing all students to major in practical snitching? Here to react is Alex Berenson. He's the former New York Times reporter, author of Unreported Truths About COVID-19 and Lockdowns. Also with me is Phil Kerpen. He is the president of the Committee to Unleash Prosperity. Alex, it's one thing to ask students to act responsibly. It's another to encourage them to snitch on one another. Joe Biden and these universities say it's a necessity based on science. Is it?
I mean, of course it isn't. There are many things that college students are at risk from. Excessive drinking maybe being the most obvious example. They are next to no risk from SARS-CoV-2. If you look, there are entire countries in Europe where large, like Italy, where fewer than 5, possibly fewer than 3 college-age adults, whether or not they're in college, have died from this illness. The CDC says that if you're under 15, and that's not college age, but the risks don't change very much between 15 and 25. If you're under 15, you have a 1 in 1 million chance of dying from this of SARS-CoV-2 if you're infected. And I feel that everybody should know these numbers. I feel sort of honor bound to repeat them over and over again because the rest of the media has done such a good job obscuring what the risks really are here and focusing on a minuscule handful of outlier cases that people are terrified. There was a study just a few days ago that showed that only 3% of Democrats said that they thought it was safe to reopen schools right now. Now, 69% of Republicans agreed. Only 36% of the whole country agreed. But so what that,
Phil,
and Democrats love to say that they're the party of science, they're the party that understands data and facts. And, if you look at what the numbers really are, the only people who understand any of this are the people watching Fox News, which is just terrible. And it's leading to terrible public policy.
Phil, your reaction. I mean, we are seeing this coast to coast. All these colleges, universities, they're basically locking these kids down. I don't know what they're supposed to do. But is it all being driven by politics? Is that what this is about?
Well, I think it's a combination of politics and irrational fear of a lawsuit or of an adverse media story. And we're punishing our youth really in an outrageous fashion. We've been doing it now for months, really since the pandemic first hit. We've been putting the most severe deprivation in terms of lockdowns, the loss of recreational activities, the loss of sports, the loss of school on the people least at risk. And Alex just ran through the numbers. They're essentially at near zero risk from COVID, but there is a severe mental health crisis among young adults in this country. We just saw a poll from the CDC a couple of days ago that 25% of young adults between the ages of 18 and 24 have contemplated suicide seriously within the last 30 days. Before COVID, before the lockdowns, before all of this, that number was 11%, which was already a crisis level. We were talking about how outrageously high it was. It's more than doubled. And, a lot of those people are either not working, they're stuck at home locked down, or they're working in an essential job without any recreational outlet, anything else to do except go to the drudgery of that and come home. If we could get back to normal on college campuses or something close to normal, that would be a huge positive for this mental health crisis. But instead, we're going to have all these kids go back, and it's going to be an extension of the lockdowns they've been suffering at home while the colleges were closed because of all these unreasonable rules and restrictions.
Trump's COVID testing czar debunked the idea that more tests will reveal increased positive cases. Listen to this.
Arizona is one of the several states across the country that has a decrease in cases, but also a decrease in testing. So are you concerned that people just aren't going to get tested because they don't want to have to wait?
There are 3 questions and assumptions there, and all of them are wrong.
I'm asking you. I'm not assuming anything. I'm just telling you. I'm looking at the numbers.
That's right.
And I'm asking a question.
You're not asking me. You're telling me. Hospitalizations are down. COVID-like illnesses are down. This is a real decrease in the infections.
Alex, why is the media incapable of absorbing and understanding these numbers? These are facts.
So look, the notion that a whole lot of asymptomatic people should be tested for this, you have to throw into question at all. You talked about contact tracing in your monologue, and the fact is, most Americans don't want to respond to contact tracing. Okay, in California, one of the bluest states, fewer than 1 in 4 people who's contacted by a contact tracer will give information about who they've been in touch with. So if people who are tested and asymptomatic and not going to the hospital, and in many cases don't even know they're sick, aren't going to respond to a contact tracer, what do we care if they have this or not? We don't care if they have the flu, or if they don't, wind up in the hospital. We don't make them get tested for the flu. So what are we doing here? This is yet another, public policy question that is sort of being forced from the top down when there's very, very little science to say that it does any good. This is true of lockdowns. I mean, that's what I talk about in the booklet, but it's true of masks. It's true of test and trace. It's true.
I'm glad
of
you
so
brought
much.
masks
and then
up,
people
Alex.
push back, and the response from the government is, we're going to force it harder.
Before I run out of time, you brought up masks. Now the CDC is saying masks with exhalation valves or vents should not be worn to help prevent the person wearing the mask from spreading COVID to others. Phil, I'll ask you, how are they criticizing these masks but endorsing homemade ones? And what do you make of the Biden 3-month mask mandate demand? Very quickly, Phil.
Well, I agree with Scott Atlas, the new member of the President's task force, that there's some limited circumstances where it might make sense to wear a mask if it's the right type of mask, a real medical mask, and you're around somebody who's highly vulnerable, or you yourself are highly vulnerable, and you're trained to wear it properly and take it off properly, never touch the outside, so on and so forth. But if you're not in that kind of circumstance and you're not willing to put in that commitment to be that careful with it, there's just not going to be much benefit from it. And there are lots and lots of studies that have shown this. And so when they start parsing this type of mask is good enough and this other type isn't, and we see the same thing with news media stories and studies, avoid this type of mask, go with this type of mask. The bottom line is there's not a lot of benefit to be had from these masks other than those specific circumstances where they make sense and when you're willing to put in an extraordinary amount of caution never to touch it and to be very careful with it and so on, which most people aren't able to do even if they try, frankly. So I think this is a little bit silly to try to split hairs in terms of what type of mask people should be using.
Alex, 30 seconds. What do you make of the Biden mask mandate coast to coast? Effective, needed?
No, of course it's not needed. I mean, as Phil said, very, very limited instances masks may be useful. And this, to me, is very scary because what it says is that if Joe Biden is elected, he's going to push in the same way, for example, or he's likely to push in the same way that the Prime Minister of New Zealand is pushing that country back into a lockdown after a handful of cases. It says he's going to be very aggressive here. And we've had enough aggressive action that hasn't done very much.
Yeah, what everybody's griping about the economic downturn. Had this economy in the United States totally shut down, we would really see economic cataclysm. We're lucky that we were spared that. Thank you, gentlemen. As I mentioned earlier, universities across the country aren't just getting students to track the whereabouts of their peers. They're turning them into snitches. Schools from Yale to Tulane have set up new ways for students to tattle on one another for failing to social distance or wear a mask. Texas A&M University is going further. They've created an online portal that allows students to report on classmates who they suspect might have COVID. Joining me now is Gage Sattler. He is a Texas A&M senior and a correspondent for Campus Reform. Gage, thanks for being here. Students should obviously act responsibly in a pandemic, but your reaction to the school incentivizing students to become COVID narcs?
Well, hi, Raymond. First of all, thank you for having me. It's a pleasure to be with you here from Texas. Raymond, I couldn't agree more with your statement that my university and certain other universities seem to be requiring or encouraging certain students to major in snitching. And I'm so thankful that, first of all, A&M officials have allowed us to return back to campus if we so choose, when so many other universities haven't even allowed that. And I'm also very proud of the fact that Texas A&M University specifically has partnered with the federal government to mass produce a COVID vaccine once it does become available. At the same time, this procedure where students are basically encouraged to report other students is concerning.
You're worried it's going to be weaponized, right, Gage? You're concerned it could be weaponized and personalized with horrible intent.
That's exactly right, Raymond. And the reason I say that is because most students have a vested interest in not reporting their fellow students because we want to be on campus. I can't think of one person I know who's not immunocompromised that doesn't want to be on campus. And so most people I know, if they see someone who's not following the guidelines, they'll likely politely say something to them, which is, I think, what should be being encouraged by these universities, instead of this tactic that really I could see only encourages people who have a personal vendetta against another student to report. A special concern to me is the fact that we have an election coming up, and I'm the vice president of Students for Trump at Texas A&M. And I know that we're going to be doing some tabling and campaigning on campus. I know some other political groups on campus will be doing the same. And, I could be at risk simply being on this show here with you to have my name filled into a form and reported.
Yeah,
I don't know.
I've seen some of these forms, Gage, from universities where there's a place to actually submit photos and video of offenders, so-called offenders. Yale has a tip line. The NCAA has set up a tip line to be notified if student athletes are being threatened by not wearing masks or people around them without masks. Oklahoma State University is taking it even further than Texas A&M. The school will track location data for devices that log into Wi-Fi access points to identify employee and student movement across the campus. They're going to store that data solely as an aid for contact tracing. Do you feel comfortable with that kind of technology being used in university settings?
I don't, Raymond. And to tell you the truth, I remember reading Orwell's 1984 in middle school, and I never could have imagined that just several years later it would be turning into a reality where I would essentially be surveilled by my fellow classmates and my university. And I know at A&M we're not implementing anything like that to my knowledge, but the fact that it is being implemented at other universities is very concerning.
Well, I worry about all of you because there are no games, there are no parties, you can't congregate at all. So the natural incentive is go off campus and have a good time, which causes the problem they're trying to avoid. If everybody's already been tested, keep everybody on campus, give them limited access to each other, but you got to socialize in some way or go home. Thank you so much, Gage. Thanks for being here, and I hope you're there through the semester and that you don't get reported.